I'm Tigist, a child and adolescent psychiatrist from Ethiopia. Today, I'm going to share our volunteer work in Ethiopia, how we are trying to build the capacity of healthcare professionals and teachers in our context. And before I start, I would like to acknowledge people who share their real photos for my presentation, and we took all the photos under the consent of their caregivers. So I would like to acknowledge institutions, individuals who contributed to this work in different ways, and including the international and national volunteers who are doing the job. I would like to disclose we didn't receive any financial funding for this work. I use the abbreviation ICAM, which stands for Infant, Child, and Adolescent Mental Health Service. So when I say ICAM, that is what I'm saying. I start my introduction by giving some background about my country and the ICAM Strengthening Project and our next plan. Neurodiversity Center Ethiopia is a board-led, registered non-profit organization, non-governmental organization, formally registered in 2023, and it has been working since 2017 under volunteer base. It provides infant, child, and adolescent mental health and neurodivergent community service, and it works in collaboration with governmental and non-governmental institutions. Ethiopia, my country, is the home for more than 100 million people, and the mean age of the population is under 18. So we can say more than 60 million of individuals are younger than 18. Most children with mental health conditions have no access to intervention, which is the report of the Federal Ministry of Health. Figures say a lot about the country childhood mental health condition. The government reported that 12 to 25% of children have some sort of mental health problem, and ADHD consistently reported more than 10% in different studies by different researchers. And suicide attempt also it's high, from 12 to 14 among adolescents. Substance use disorder reported more than 50%, but this is in a specific area of the country where chat use is more prevalent, which is associated with alcohol and cigarette. The child and adolescent mental health service in the country, represented by 3 child and adolescent mental health clinics. The one we opened in collaboration with colleagues, the third one. No child and adolescent mental health care in rural Ethiopia, where more than 95% of the population live, and no inpatient facilities in the country, poor multi-sectorial collaboration, and no community-level child and adolescent mental health service. So as a child and adolescent psychiatrist, when assigned to the tertiary level clinic, I was sitting in the clinic and 26 caregivers and children diets are waiting outside for me. So I can't see all the patients together, so I discuss with my colleagues and supervisors and mentors, what can we do? So we plan this. So initially, we established the multidisciplinary team in our hospital. Then after that, we recruit the ICAM cadres from different public sectors and non-profit organizations. And we provide training support, then the service development. After that, we continue monitoring and evaluation of the program. So this is how we started. I joined the ICAM, the Infant, Child, and Adolescent Mental Health Capacity Building Team in ICAPAP, which is an international organization And the 5 colleagues volunteer in our project. So we did situational analysis from different settings. So in different settings, then we identify the gaps and so plan how to bridge the gap, which is human resource development and awareness creation in the community. This is the hospital, the biggest child and adolescent mental health unit where I'm working. And this is the initial caregivers consultative meeting. Before starting anything, we involve the caregivers and adolescents in their care. So this is still ongoing work. Sorry. So it has been now. This is the second year when we since we started. So we choose the 3 pilot sites first. Then for the second year we have 5 pilot sites. In the first year we trained 28 care professionals. The second year, phase 1 training, 19. Level of the training is 2. Which is what we plan to give 2 levels of training for healthcare professionals, 2 refresher courses, 1 for teachers. And then the team members, which I just showed you before, they monitor the program meeting regularly. So currently we have more than 10 organizers of the, sorry. Next slide. So these are the materials we adapted to the country context. All are free materials except this book, and we got it from the author directly. So on the initial basic training, we use ICAPAP MOOC training, but it was in person. And this was around the professionals, 19 and 17, from 5 different disciplines. Mid-level healthcare professionals were recruited, and we included generalists on the first year of training. 5 days training, no dropouts on the second year. First year we had 2 dropouts. The post-test quiz was higher, 80% score on the first year. The second year was low, and still we are investigating why they scored low. And the case-based tests, which is real practical cases we provide to the participants so that how they diagnose and refer, it's higher in both groups. So we collected feedback after that. All participants think that the program is relevant and informative, and 4 think that 5 days training is short. And all reported that sharing experience, getting insight from the experts is important. And 3, some of them, they don't like the quiz, the post-exam quiz, 9 of them. And then in the future, we asked them, because conducting in-person training is not easy, so we asked them which modality, but still majority choose the in-person. And psychosocial intervention is a choice. On refresher course, we develop the assessment tool and training for interview guide for healthcare professionals, and we train them and we received feedback. So this is the second phase of training. Some of colleagues and mentors participated in this. They provide pre-recorded session for our trainees. So it was 7 of them joined for direct question and answer virtually, which went well, and many of the participants liked it. In the feedback of the advanced clinical training, most of them agree that the program is appropriate, relevant, the materials were appropriate, and they feeling intellectually stimulated, and they have confidence to see child and adolescent patients after receiving the second phase of the training. Currently, our trainees with the 28 from the first year and 19 from the second year, They are working in general hospitals. The psychiatrist you see her here, she is one of the young psychiatrists who started the third child and adolescent mental health clinic in the capital city. And there were two, one left the country, so now she is running the psychiatric OPD, and I provide her telephonic consultation, and she sees 10 patients every day. And 2 health centers, we have active 2 health centers currently. One government orphanage where children get free child and adolescent mental health service, and one provides international school. The other 3 works in non-profit organizations. 12 are in tertiary care, including the college I'm working. They are general psychiatrists, some are GPs, but they are providing the CAM service, and 1 left the country. The second category of our involvement is public education and links with other sectors. Some participants request additional courses, so we try to arrange monthly webinars for them so that they can fill the gap. And we have monthly caregivers workshop on child mental health, specifically neurodevelopmental condition. We have consultative meetings from government workers, other stakeholders, and schools, and we have regular radio programs and once in a month TV programs in different ways. And this is a fundraising event. The children with neurodevelopmental conditions, they participated directly in the painting, drawing, and music demonstration so that they can raise funds for the organization. We have been doing a lot of things since we have started in March 2023. The challenge we have is funding. All of the employees are volunteers. We don't have a single paid worker in the organization. So we are trying to apply funds, still some are on the way, and we haven't succeeded yet. So it's really worrisome whether this project is going to continue after 2 years or not. Our next plan is to have e-version of child and adolescent mental health training, which is questionable in our context because of the internet access we have in the country. And we are planning to open the first inpatient care in the country. We received the place, so just we are trying to get funds to make it child-friendly and safe for the kids to provide the service. In conclusion, this program shows the promise ICAM training contributes promoting the integration of ICAM service in the existing healthcare system. We are focusing on public sectors and non-profit organizations. And the second one is digital delivery presented the potential for ICAM to be more widely disseminated globally and in African context. To learn about our organization, you can email us, follow us on social media, and you can get information on the website. Thank you.